As a man, it's important to recognize that your body goes through certain changes as you grow older. The changes that a man goes through are not entirely unlike those which a woman go through, in a way. Male health is largely associated with testosterone levels, and as men get closer to middle age, their testosterone production starts to drop, first slowly, then at a faster rate. Eventually, men start to feel these changes in their mind and see the changes in their body. When testosterone decline starts to become symptomatic, this is a condition known as andropause, but also known as low T or hypogonadism. Symptoms of low T and testosterone deficiency. Testosterone deficiency has a wide variety of symptoms associated with it, but there are 5 symptoms that you really need to look out for: depression and anxiety, fatigue and exhaustion, declining libido and sexual function, loss of muscle strength and tone, buildup of unwanted body fat. Of course, many of these symptoms share similarities with other disorders. These can also simply be the symptoms of a sedentary man just getting himself in a rut. If you feel that you are experiencing the symptoms I previously mentioned, it would do you some good to go visit a qualified physician and request to have your testosterone levels tested. Low T testing has become much more accurate over the last decade, as methods to analyze both total and free testosterone have become more sophisticated. Because of this, it's easier for your doctor to give you a direct diagnosis without having to rely simply on his intuition and your symptoms. Testosterone deficiency is associated with a number of other conditions, including coronary artery disease, hypertension, depression, and diabetes. These conditions all share symptoms with low T, and also men with testosterone deficiency are at increased risk of these conditions as well. This is why diagnosing testosterone deficiency with any sort of certainty requires blood testing. There's no way to tell just from the symptoms that you are suffering from low T, other than the fact that people with low testosterone levels are more likely to experience these health issues. Hormone therapy has long been used by women suffering from issues related to menopause, but it has only been in the last 10 to 15 years where testosterone therapy for low T has become more widespread. Perhaps it's because for women, menopause is much more sudden than male andropause, or perhaps it's because men don't seek help for age-related health issues as regularly as women. Whatever the cause, men are benefiting from andropause treatment like never before. With testosterone replacement therapy, it is possible to mitigate and overcome the symptoms of low T and live a life of greater vitality, strength, and lust for life. Although most men think of low T as an older man's disease, the condition actually affects men of all ages for a variety of reasons. Sometimes it's genetic, other times it's the result of issues like testicular cancer or trauma. In these cases, the only way to improve your testosterone levels is through bioidentical testosterone therapy. Most men with testosterone deficiency suffer from andropause or age-related testosterone deficiency. However, as you grow older, the threshold of maximum testosterone production, that your body can reach naturally continues to decline, but you can maximize your testosterone levels at any age by engaging in an active lifestyle with a healthy exercise routine. The way that our bodies work, our bodies release high concentrations of testosterone after a workout, and the level of testosterone released depends on how hard and completely we work our muscles. Clinical research shows that a workout boosts testosterone concentrations in the bloodstream from 15 minutes to an hour. These peaks in testosterone level are hypothesized to help sustain hormone balance and overall health. For men with clinically low testosterone, even exercise isn't enough to stimulate elevated testosterone production. But for men with testosterone levels that are normal or borderline, exercise enhances testosterone concentrations in the bloodstream, which provides a number of worthwhile benefits, helping to sustain physical, psychological, and sexual health. There are 4 primary factors which affect your testosterone production. The older that we get, the less our bodies are able to naturally produce those testosterone spikes associated with exercise. Exercise still promotes elevated testosterone production and promotes balance, healthy body composition, strength, and bone mineral density. The bigger that we are, the harder it is for our bodies to produce enough testosterone to meet our needs. This is because body fat naturally converts testosterone to estrogen and promotes other factors which inhibit testosterone production. Keep off the weight to keep testosterone levels as high as possible. Testosterone concentrations reach their peak in the couple of hours after you wake up in the morning, until around 10 a.m. They fall to their lowest point after lunch in the afternoon. Studies have shown that engaging in anaerobic exercise in the late afternoon or early evening has the strongest impact on testosterone production. The level of testosterone your body produces depends on your activity level. If you live in a sedentary lifestyle, your testosterone levels will remain low. When you first start an active exercise regimen, your testosterone production spikes hard because your body isn't used to it, and then testosterone spikes balance out as you become more fit. Any form of exercise that you engage in has a positive impact on your testosterone production. Both anaerobic exercise and cardiovascular endurance-based workouts will give you a boost. Experts in exercise science have discovered that taking these steps can help you squeeze the most testosterone out of your workout. Don't take long breaks between exercises or sets. Focus on slow, steady reps with higher weight rather than quick reps with lower weight. Shorter sets are preferred over longer sets when done correctly. Engage in exercises which work out entire muscle groups and emphasize balance. This helps you work out muscles all over the body, and the more muscle groups you work, the more testosterone you produce. Always give your body time to recover. Alternate between muscle groups and always give the different groups 48 hours of rest. In order to sustain your total health, it's important to encourage flexibility, strength, and cardiovascular endurance. It's also important to recognize that a healthy diet is a key component of an ideal workout regimen. If you are out of practice, take it easy and develop your training regimen as you go in order to mitigate the risks associated with rapid changes in activity level. Also, don't work yourself too hard. If you push yourself past your personal limits, this actually works against you and can prevent your testosterone production from reaching its peak. If you found this video informative, please press the like button and subscribe to the channel. To learn more about health and wellness regarding testosterone replacement therapy, please click the link below in the description.